So, about vasculitic wounds, what are those? The main point is that there is an inflammatory reaction in the blood vessel, and that leads to ischemic necrosis and very often very painful necrotic ulcers. And with these patients also comes this holistic view. It is very important to search for the causing agent, which might be infection, drug, or malignancy. But very often these cases remain iatrogenic, so that we don't know the causing agent. But still, we have to search for those very actively. And there are very many types of vasculitic wounds, and recently there has been published a new nomenclature about vasculitic wounds. You will find the reference in our module, but I won't go into the detail now on that. I only want to highlight that there are some key elements, some key clinical features that might help you to suspect a vasculitic wounds. And those key elements are first, purpura. That means it is a red spot that cannot be blanchable. And then livedo racemosa, that is usually a violet streaks, some strangulating pattern that occur usually in the legs. There are some pictures of livedo racemosa in our model. And then these, as I mentioned, necrotic wounds that are very painful, and also subcutaneous nodules. If you see these clinical features in the patients, then you could suspect a vasculitis behind the ulcers. And for diagnosing vasculitis, it is very important that you promptly refer the patient to a dermatologist or a rheumatologist, and there must be taken a biopsy from the right site and with the right timing for these purpuric or necrotic lesions. The treatment consists of immune suppressing treatment. That is the most important. And it differs from with the severity of the vasculitis. Many times an anticoagulant is also added to the treatment because vasculitis and occlusive vasculopathy are overlapping syndromes. Very many times there are both vasculopathy and vasculitis. And after the immune suppressive treatment has been for a while, like 2 or 3 weeks, after that, you can do also mechanical debridement and all the modern treatments of wound healing.